The uninterruptible power supply is turned on by pressing an cabinet holding the button for a few seconds. Input. It worked. Then on we hear turning uninterrupted. Power supply. The CO was ignited. The EBT was blocked and exited. We can now start the computers and access the system. System startup failure. Click on the left mouse button and the central game trace on. The second set is also launched. Then we turn on the patient screen. The patient screen transmits data from the computer to the gaming environment. If we need to switch the patient screen to a computer with a control program, for example, to demonstrate an environmental feedback system, video source 2 is part of the university system. You can also enable the vector game SIGINT. That is, the shutdown occurs accordingly, in this order. The program turns off. Computer turns off 1. Computer turns off 2. Shutdown. Also by pressing holding a key. A separate patient tab is provided for entering the database. If the procedure is performed on a patient for the first time, click the New button and fill in the following information about the patient: last name, first name, patronymic if available, gender, date of birth. In the notes we can indicate the patient's diagnosis or other necessary information about the patient. Height is filled in increments of 1 centimeter. The weight is filled in increments of 1 kilogram. In this case, the weight must be indicated with an error of no more than plus or minus 10%. This directly affects the operation of the complex. When you finish filling out the information, click the Save. If you need to make changes to the patient information, click the Change button and make the necessary changes. After making changes, you must click Save again. After filling out the information or selecting a patient, click the Start button. Go to the Preparation tab and we can start lifting. Patients who have completed the course of therapy can be transferred to the archive by clicking on the appropriate. This is necessary to ensure that only patients undergoing therapy are present in the main window. Simplifying patient selection. If the patient comes back for a second course, we can restore this data or delete it. When restored, they reappear in the main window. We can use this data to select a patient.
Before the patient is placed on the couch, a cuff of the appropriate size is placed. A disposable pad is placed in the head cuff and secured to the cuff using adhesive inserts in order to prevent contact of the cuff with the patient's mucous membrane. The patient is placed on the couch independently or with assistance. The patient should be dressed in comfortable, non-restrictive clothing with long sleeves and a leg that is sufficient to cover the wrist and ankles to prevent the cuff from coming into contact with the patient's skin. Next, you need to adjust the distance between the modules, moving them so that the cables are positioned vertically, respectively, subject to the segments of movement of the modules and carried out by the handle. The cuffs are secured to the patient's body. Only the lower chest cuff is not attached to the patient's body. After securing the cuffs, the ring and each cuff must be secured in the appropriate cable carabiner. The Raise button and the Lower button are located on a separate Preparation tab. After placing the patient, when the operator presses the lift button, the patient is raised in 3 stages. The first lift is pre-tensioning of the cables. The second is to preliminary raise the patient 10 centimeters from the couch. And the third button to raise is to raise the patient to the working height. The operator can return the patient to the previous stage by pressing the lower button at any stage. Press the lower button 3 times to lower the patient. For electrical stimulation, we use an electrical stimulator from the Cosima company, NIA Stim 5. The stimulator has unique characteristics and wide functionality. The stimulator is charged through a special charging unit. The unit is connected to the side of the stimulator using a special connector. The unit itself is connected to a 220-volt power outlet. The switch is in the on position. The orange LED on the charging unit lights up. When fully charged, the indicator will be green. While charging, it is impossible to work with the stimulator. Channels are blocked. This is done for safety. The stimulator for communication with a computer has a radio module that is connected to the computer with the complex control program in any of the free USB ports. Turn on the electrical stimulator. On the Stimulation tab, we see the serial number of the stimulator and the battery charge. This means that the control program has connected to the stimulator and we can use it for its intended purpose. The stimulator kit includes wires that are connected through a special connector to the channel outputs. In the standard version, the stimulation wires end with a 2M pin connector. A special adapter is connected to the pin connector to allow the use of standard push-button electrodes, which are cheaper and much more profitable than pin-type electrodes. Of course, it is more convenient to use electrodes with a pin connector somewhere in clinical practice, but it's quite expensive. Using an adapter, you can use inexpensive electrodes. On the Stimulation tab, there are settings for each of the 5 channels, separately, where we can configure all the stimulation parameters. Start and end of pulses. Stimulation through signal settings. We can turn on and off the necessary stimulation channels. Assign the stimulation side for the selected channel. Set the current value. If you use a series of pulses, you can adjust the stimulation frequency from 1 to 99 Hz or use a single pulse for 1 movement cycle. Any change. In the stimulation channel, settings must be confirmed by pressing the Apply button. In order to select the current strength for a specific patient, you can use the Test button. When you press and hold the button, a test pulse with the specified parameters will be sent. If you release the button, stimulation stops. This is convenient for determining the sensitivity threshold. For determining the muscle response. The stimulation signal, that is, the start and end time of stimulation, can be selected. The stimulation signal is adjusted in the correct direction. To add a new signal, click Add. Fill in the name of the new signal that we want to create. Press Enter on the keyboard. Select the department and what extension action will be taken into account when choosing the beginning of the signal. For example, we chose femoral flexion. This is the moment when the angle formed by the Waist, femoral and ankle suspension begins to decrease. The moment of the signal to start stimulation is set from the transition point from extension to flexion. That is, it corresponds to the phase of the beginning of contraction of the knee flexor, backhand between thighs. After assigning the signal, click Save. We close the window. We select the new signal in the stimulation channel settings. You can use any number of channels from 1 to 5. Apply the changes on the left side of the screen. The Apply All button applies the changes to all channels or for each channel separately. The Apply button in the channel settings. We turn on the necessary channels. We adjust the current strength of a series of pulses or single ones. We select the pulse duration according to the method. We also select one of 3 pulse shapes. The pulse shape can be viewed on the screen. Unmodulated pulse. We set the pulse duration in the program. Since there is no modulation, its settings for this pulse do not matter. In addition, this is exactly the duration of the pulse, a unipolar modulated pulse. The modulation frequency is adjustable from 4 to 10 kHz in the program, and a bipolar modulated pulse. After we have set the stimulation channel settings, we can create a stimulation profile. To create a profile, press the plus sign, set the profile name. Press here on the keyboard to save the new name. Let's set up stimulation channels. And click Save. Now we have a saved profile with a new name. Now we have the ability to call up profile settings by selecting it in the drop-down window. These settings will be applied. The work of the complex operator comes down to choosing the required movement profile with the required frequency and amplitude. Correctly apply the electrodes according to the treatment protocol and apply the required stimulation profile. Click Apply and click Start. The patient will be stimulated with the necessary movement and the required stimulation profile. Frequency of stimulation. We can set the number of periods when stimulation will be performed and the number of periods without stimulation. This is necessary in order to reduce the current load so as not to overstimulate weakened muscles and allow the patient to work independently through a given number of cycles. If the number of inactive periods is 0, then any number of active periods will lead to the stimulation every time, every period without skipping. The stimulator is stopped using the Stop button in the complex control program, or it can be done using the Stop button on the Operation tab of any of the emergency stop buttons of the complex. Or it can be done with the Stop button on the front panel of the stimulator. Red button. Let's show one stimulation technique. Classical spinal cord stimulation, where passive electrodes are applied in the iliac region. Active electrodes are applied in the projection of the lumbar enlargement of the spinal cord. This is the level of the 12th thoracic first lumbar cusp, 2 paravertebral electrodes or 1 electrode in the projection of the spinous processes. We apply disposable electrodes with an adhesive layer in the iliac region on the right and left. The patient lies on his back. It is not shown in the video, But before gluing the electrodes, it is necessary to degrease the skin with alcohol containing a solution. Passive electrodes. This is the red wire. In this case, we apply the first channel to the left side according to our method. We apply the red wire of the second channel to the right side. We attach it to the push-button connector of the electrode using the complete method. Use of the stimulator with the complex described in the manual and instructions for use. We turn the bait from the patient through the block facing the operator. We apply active electrodes in the projection of the lumbar enlargement, or by palpating the crest bones. We find the aestheticist from the growth of the fifth lumbar vertebra, count to the first lumbar, or determine it at the end of the costal arch. You can roughly understand the location of the 12th thoracic vertebra. We apply 2 electrodes paravertebrally on the right or left. The distance between the electrodes is approximately 1 centimeter. This makes it possible to receive a selective muscle response on the right and left sides. For example, when stimulating receptive locomotion, such as walking, crawling. Blue color, this is the active electrode, blue wire. You also need to not confuse that the first channel is our left side, and the second channel is our right side. Be sure to indicate the stimulation side when setting up the channel in the program. We secure the cuffs and raise the patient to working height. Now we will apply the jumping movement profile and the jumping stimulation profile. The signal for stimulation is the beginning of extension in the waist region, that is, in the hip joint. This stimulation start point is indicated by a green triangle on the screen, and the actual start time of stimulation will be a green circle. We shifted the timing of stimulation so that the stimulation pulse was delivered at the height of hip extension. Let's set up a series of pulses with a frequency of 7 Hz. Let's adjust the current strength. We adjust the current strength by receiving feedback from the patient. You definitely need to ask how he feels and tolerates it. The blue part of the arc is the time when stimulation will be performed. That is, we move the beginning of stimulation away from the point of transition from flexion to extension, and we also shift the end of stimulation by moving the red circle. That is, we carry out stimulation somewhere in the middle between the points of flexion and extension of the beginning. Only in traffic, the simulator display shows green during a simulation. The first and second channels are operational. The Duke's virtual gaming environment control sensor is used to control the character in the gaming environment. The complex comes with 4 sensors, 3 of which are used simultaneously and 1 spare sensor. 2 sensors have a wrist mount in the form of a strap, attached like a watch. 1 sensor is mounted on the patient's body. The sensor is located on the back in the area of the spinous processes of the second and third thoracic vertebrae. The sensor located on the body is used to select the direction of movement and recognizes the movement of the body up and down, right and left. And the sensor is located on the hands to select the direction of movement and to recognize gestures. DUS sensors must be charged before starting the activity. The sensor is charged using a standard micro USB connector. Connect the USB cable with one end to the sensor and the other to the USB connector of the monitor. If the sensors are not in use, we recommend keeping them charged at all times, and if necessary, they will always be charged. To work with the sensor, the control program provides a virtual environment tab. By default, the sensor is always in sleep mode. To save battery power, you need to press the button on the sensor to wake the sensor from sleep mode. After this, it will wake up from sleep mode. The green LED will flash. The sensor will be available for connection to the program within 30 seconds. Click Scan. The program searches for sensors available for connection and displays a list of them on the screen. In the search column, there is a Find button. When pressed, the corresponding sensor will begin to periodically create a sound signal. To turn it off, you need to press a button on the sensor. Or if we press a button on the sensor is displayed on the screen. The selected operator selects from the list the sensors necessary for the current session. Indicates their location on the patient from the list. Body left hand or right hand. After connecting the sensors and determining the role, the sensors need to be attached to the patient. The hand sensor is attached so that the LED is directed towards the hand. The sensor for the body is attached in such a way that the LED is directed towards the head. The principle of fastening itself was shown earlier. Before starting a session, the sensor must be calibrated. To do this, we stop the movement if it occurred and ask the patient not to move during calibration. Press Calibrate sequentially for all sensors. Calibration lasts approximately 5 seconds. During this time, it is necessary that the patient maintains a stable position. After calibration is completed, the sensors can be used. Press the Start Session button. The program will begin transmission position of the sensors in the virtual gaming environment program. The sensor located on the body is used to select the direction of movement: left, right, bottom, and up. The sensor located on the hand recognizes the following gestures. By sharply turning the wrist clockwise and counterclockwise, supination and pronation must be performed. Objects in the hands are changed. You can choose either a camera, you can choose a harpoon, or without an object in your hands. Hands. During the game, the sensor recognizes the style of a smooth breaststroke. That is, by making an intensive movement of the mushrooms with your hands, you can increase the speed in the game. To turn, you need to make more intense mushrooms with one hand. Lunging forward with your hand is an action, that is, for example, shooting a harpoon or taking a photo. The sensor reacts to acceleration. The movement should be sharp. For example, you can clap your hands. This will also have an effect. To configure the sensors, you can set control parameters. The horizontal tab is for setting left and right movements. Using the slider, the sensitivity is adjusted to a response that relates the patient's movement to his movement in the virtual environment from 1 to 10. If we reduce the sensitivity, a larger angle of rotation of the sensor will lead to less rotation in the game. Conversely, a high sensitivity value will result in sharp, fast turns. By default, all values are set to 5. Suitable for most players, but if you need to customize the parameters individually, it can be done. Using the hand and body checkboxes, You can select the source for controlling left-right movement from the body only, or from the hands only, or from both sources. The same goes for vertical. Parameters for controlling up and down movement, sensitivity and signal source are given. To stabilize vertically, use the correction slider. If the patient's position suddenly changes after calibration and the avatar moves up, you need to lower the slider down. And vice versa. Accordingly, if the avatar takes it down, you need to raise the slider up. The Speed tab allows you to set parameters to control the speed of movement in the game. With a low sensitivity coefficient, the speed decreases. With a high value, it will increase. On the Item in Hands tab, using the checkboxes located under each slider, you can select which hand will recognize gestures with the right or left or both hands using the action sliders and change the sensitivity for recognizing the corresponding control gestures is set. The higher the value the actions are recognized, the heavier on 8 we call it. Shot setting. Let's set the sensitivity to 10. Now it has become more difficult to fire a shot. That is, only a very sharp movement allows you. To perform an action. At setting 5, this is much easier, and at 1, in fact, even a small impact on the sensors triggers the action. The sensitivity value should be selected according to the child's skill. The child must try to fire the shot. If the pair is expressed and it is difficult to extend your hand, you can clap. At the end of the session, you need to click the End Session button. Data transmission from the sensors will halt. During a session, a situation may occur when the avatar in the game begins to swim in an arc to the left or to the right. Despite the fact that the patient has straightened up and wants to swim straight, there may be several reasons. For example, the initial position of the sensor is lost. To stabilize in the game with Untitled, press the button straight and the avatar begins to swim straight again. Movement parameter. Amplitude is the maximum value of the displacement of the motor segment below the average value, that is, from the working position. The range of movement is equal to 2 amplitudes. This parameter is set for each motor segment separately, depending on the patient's height. The amplitude value increases from the head to the feet. The overall amplitude of movement is controlled by a bubble in 0.5 cm increments ranging from 0 to 30 centimeters. In this case, an increase in the value of the total amplitude leads to a proportional increase in the amplitude value for each motor segment. The amplitude of each actuator is adjusted separately, on the Profile tab ranging from 0 to 300% of the total amplitude. Frequency is a parameter that determines the number of movements per second. One frequency is set for all motor segments. The frequency is controlled by a slider ranging from 0.05 to 1 Hz in steps of 0.05 Hz. On the FAS Profile tab, phase shifts between departments are configured. By default, they are calculated proportionally to the anesthetic data. The phase shift of each actuator can be adjusted from 90 to -90 degrees. Changing the phase profile in the selected section will lead to a change in its movement relative to the other sections. Common phase control results in a proportional phase change for all departments, controlled by a slider ranging from 150 to 210 degrees. The values of the output characteristics, such as frequency and amplitude, together determine the maximum speed and acceleration of movement. The operator is not able to set the amplitude and frequency of movement so that the acceleration of movement exceeds half the free fall speed. That is 4.9 meters per second square. For any actuator, starting and stopping work is done using the start and stop buttons, respectively. Any changes in the main mode will be applied after clicking the Apply button and canceling the changes using the Return button. Motion profiles were created to simplify the complex's motion settings. Motion profiles can be created, saved, modified, and deleted. Let's create a new motion profile. We select the value of the movement parameters in the general setting: frequency and amplitude, amplitude profiles, phase profiles.
Профили фаз.
You can configure in-phase and anti-phase movement in the lower left part of the screen. Click Apply. We monitor the patient's condition. If the new profile suits us, we can save it with a new parameter. For this menu in the profile in the upper left corner of the screen with the key from it, select Save As. A window will open where you can save the profile with a new menu. When selecting a menu, save. We will keep the current one. Profile with new parameters. When you select Edit, you can change the description of the current profile before saving. Access the created profile from the Profiles menu. In the pop-up window, select Open. Select the desired profile. Open and apply. Movement profiles are essentially movement types. After applying the profile, adjustments can be made as follows. General settings on the left side of the screen, yes. And for each module separately or even for a separate suspension, the screen shows typical settings. Testing is carried out on a separate test tab. To conduct a test, press the button of the selected test. The screen will display a request for the operator to change the motion profile, where the amplitudes and frequencies are indicated. Having assessed the safety of the settings for a given patient, click Continue. Within 10 seconds, the program will automatically switch to the movement profile of the selected test. After switching to the movement profile, a request to the patient will be displayed on the screen. The operator should recommend that the patient relax. Click OK. Within 20 seconds, the complex will calibrate. After calibration, the screen will ask the patient to work. The operator recommends that the patient work, that is, reproduce the movement profile. After this, click the OK button. The complex will test the patient's performance within 20 seconds. The program supports the following tests. 4 standard tests: swimming, walking, crawling, jumping, and free test with any movement parameters at the discretion of the operator. To conduct the test freely, we recommend creating and saving a motion profile with the selected settings and conducting free testing only using the ready-made profile. Motion parameter settings are presented. The upper part is the amplitude, the lower frequency, and the test time. During the test, the percentage of completion of the test stages is displayed. 3 stages of motion profile change: calibration or evaluation stage, 0 to 100%. The total time for one test is 1 minute. The presented tests allow us to assess the dynamics of motor function in the regulatory process and the main muscle group that requires motor learning. At the end of the test, the following data is entered on the screen. The useful work value for the left and right side for each module. The patient's work when moving from the top to the bottom is assessed separately. This is the bottom row of results, and when moving from the bottom to the top row of results. Average of left and right sides. Only two values are averaged. Average value for all estimates total. The total value shows the effective average performance of the patient. An increase in this parameter indicates an increase in muscle effort in the required phase of movement. All test results are saved on the left side of the Tests tab, where the date, time, test number, and result of the saved test are indicated. We can click on a line and it is possible to simultaneously view any two test results for easy comparison. At any stage, testing can be stopped by the operator by pressing the Cancel button in the lower right corner of the screen. Cancel is not pressed if the dialog box is open, that is, close the dialog box and press the Cancel button. Once the test is completed or cancelled, the motion settings will revert to the previous test settings. It is recommended to perform 2 tests for each patient in one session. One in-phase test is swimming or jumping, and one anti-phase test is walking or swimming. At the same time, jumping and crawling are simpler locomotions compared to walking and swimming. The top table shows recommended tests for children with cerebral palsy depending on the level of motor function on the GMFCS scale. The lower table shows the muscle groups involved in each module. Go to the Work tab. Using the motion profile, select Swimming. We apply. For work, we can use 4 standard profiles. In-phase swimming and jumping profiles. Anti-phase profiles of crawling and walking. After startup, all actuators operate in forced sinusoidal motion mode. The swimming profile is locomotion of medium complexity. Synchronized movement, where the left and right halves of the body move together, imitates the swimming of a dolphin or free diver. We start swimming lessons, especially when spasticity occurs. This locomotion relaxes the muscles well. Amplitude, phase frequency can be cancelled during movement. The amplitude and frequency values are selected by the operators of the complex depending on the patient's motor capabilities. It is recommended to gradually increase the amplitude and frequency values, while noting the patient's well-being when pain or discomfort occurs and limit the value of the output characteristics. Only the patient's independent work leads to the expansion of long-term opportunities. Therefore, you need to try to involve the patient so that he is active. The next jumping profile is a fairly simple profile that many children can repeat. We'll even meet everything at this level on the GMFCS scale. The movement changes within 10 seconds after applying the new settings. Jumping movements are characterized by joint work in the large muscles of the lower extremities. Simultaneous flexion and extension of the hip and knee joints. We also gradually increase the amplitude of movement. We recommend that the patient repeat the locomotive. Next, crawl profile. A fairly simple profile where you can restore the interaction of the muscles of the body and legs, and restore the interaction between the right and left halves of the body. That is, work on the receptivity of movement. In antiphase mode, called crawling mode, the left and right plantillas move in opposite directions. Crawling is one of the basic locomotions that children master, one of the first during development. The last movement profile is walking. Imitation of walking in fairly complex locomotion, even without support. The complex has a function called assistance mode or assistive mode. A mode in which we create the opportunity for the patient to participate in the construction of movement, change the amplitude of movement. The frequency is set by the program. On the Help Mode tab, the operator has the ability to switch each group of actuators to this mode by clicking the Enable button under the selected department. Now we will enable it for the femoral section. In this case, the label on the button will change to Pick Up. Now the hip does not work along a given path. If we stop him, we will succeed. Assist mode allows the patient to move independently. Here, the complex only aids movement. And we can help him with this by adjusting the proportionality coefficient and the stiffness coefficient, which are set for each actuator or department. When first switching on to the assistance mode, the value of the coefficient is equal to 0. The operator gradually increases and sets such values at which the motor segment begins to move. The proportionality coefficient is adjusted using a slider from 0 to 100%. In this case, 100% is the force value at which for the selected motor segment, taking into account the mass of the acceleration segment, it will not exceed a quarter of the free lift acceleration. The proportionality factor works in such a way that a small amount of force is generated by the motor up and down according to the movement cycle, as happens in the main mode. You can adjust it with the wheel by hovering the cursor, either by grabbing the left key slider above. The patient must implement exactly the movement pattern that is configured. To do this, you need to make it clear how the movement occurs using the main mode. We see that at the moment the left leg is moving better. Therefore, the individual patient adjustment for the left leg is smaller. By pressing the T button, you can adjust your right and left legs differently. If we change the movement profile, for example we change jumping, the assistive mode will also be used to trim the mice. If the movement is not a swimming one, but a pushing one, let's add the lower leg to the assistance mode. Now it will be more difficult to make the movement. Setting the ankle coefficient for the module. You can show the patient how the movement is made so that he understands the drawing. It is very important that the patient gets into the required phase of movement. At first, the movement may not work out, but from session to session, as a rule, it turns out better. It is necessary to draw the patient's attention to the rhythm of movement. It's very important to get into a rhythm. Amplitude can be gradually increased. To exit the help mode back to the main mode, you need to grab back either the top part of the screen, then all modules will go into the main mode, or directly below each module, then we will take only one module out of the help mode. We have removed the ankle from the assistive mode for the limp mode. The assistive mode is preserved. The proportionality coefficient is not related to the correct execution of the movement and does not depend on the amplitude settings. The stiffness coefficient is exchanged in order to return the movement to the trajectory in case of lack of coordination and Lack of movement control. The stiffness coefficient is gently directed downward to correct movement. The coefficient value is also adjusted with a slider from 0 to 100% when you first enter the assistance mode. The rigidity coefficient takes into account the difference between the current position and the position that should be programmed. That is, the length of the motor segment affects the strength of the torque, trying to bring the current position to the programmed one. Since the stiffness coefficient tends to align to the current position, the amplitude value has a direct impact on motion control. If the patient manages to maintain the rhythm of movement even in some cases, I do not recommend using a stiffness coefficient. In total, for any values of the coefficient, proportionality, and rigidity, the acceleration of movements will be no more than half of the acceleration of free fall. Physiological feedback is a technology in which a person, through an external feedback circuit, is presented with information about the state and changes in certain physiological processes of his own. In our case, the patient's efforts during work are assessed and displayed in the form of graphs on the x-axis, time in seconds, and effort in newtons on the y-axis. The patient's efforts when moving from the top point to the bottom are assessed separately and dashed lines are entered on the graph, and the movement from the bottom to the top is separately entered on the graph in the form of a solid line. Work using BOSS is based on the assessment and control of effort in individual muscle groups by the patient himself. Muscle assessment effort is made by comparing the level of the graph for the relaxed state of patients with the level of the graph for the produced effort. And the value of effort can be assessed as the difference between these levels. That is, the level of relaxation and the level of effort. In the example given, 5.5 Newton. That is, the force is 0.5 Newton, relaxed minus 5, 0.5 minus 5, we get 5.5. If graph lines of the same color diverge in different directions, as shown on the screen, then this is either an increase in tone in the muscle, or a manifestation of spasticity, or a manifestation of incoordination in movement. That is, the patient produces efforts in both phases of the movement, regardless of whether the movement is up or down. Here the screen shows the correct or incorrect performance of a motor task for one lower limb. That is, the second leg is relaxed. The patient has a hastened plastic dyskinetic form, quadriplegia with a predominant lesion of the right side. The BOSS tab is displayed on the patient's screen using the TV item by selecting the appropriate video input on the screen. The patient's ankle module was read. Left-hand side. The patient is asked to press down, strictly in the phase of movement from the top to the bottom. The dashed line should move upward in this case. The patient tries to move the flow line graph upward. In this case, we will see that the graph diverges in different directions. That is, the patient cannot cope with a motor task. It is necessary to explain and convey this task to the patient that only the flowing line should move upward. To do this, you need to press down in this case with your foot, only when the foot goes down. Here the weight is adjusted, that is, in a relaxed state, the patient, in order to reduce both lines to 1, adjusts the pressure in the pneumatic cylinder. The motor task is the same. The patient is partially able to complete the task, but not very confidently. Over time it will get better and better. That is, motor learning is built on this. We will try to do the same for the right leg. The operator can independently select which modules and which side will be displayed on the screen by checking the appropriate boxes. On the right side there is a more pronounced pair of S with the same motor task. We do not see effective work of the knee extensor. In the lower corner, you can configure the parameters for displaying information on the screen. String time from in minutes. This operator sets the initial time for displaying graphs. The minute range specifies the range along the time axis, x-axis from 1 to 10 minutes and in 1-minute increments. That is, in this case 3. This means the screen shows 3 minutes of work, respectively 2 or 1 minute. We are increasing the screen resolution along the x-axis. The auto sound of the X scale is checked by default. It allows you to display the present time, that is, to always show what is happening, and the Y scale. The operator sets the range of forces along the axis from 1 to 100 newtons. That is, you can increase or decrease the screen resolution in regarding the patient's efforts. Now we will ask the patient to work with his knees and display the graph of the fourth module on both sides. The task is the same, but now the knees need to be pulled down during the downward phases of the movement and the legs must be relaxed during the upward movement. It is clear that a certain amount of work is being done. That is, the patient can create effort, but at the same time it is discoordinated. That is, it is not entirely possible to distinguish between upward and downward movements, but partly, especially with one leg, it is a little better. Situation: if the operator does not see a solution, the patient is not feeling well, there is severe discomfort, or for some other reason the patient wants to urgently complete the procedure, or the complex does not respond to commands, you can press the red button, turn off the complex, that is, make an emergency exit. The complex turns off the power, the distributors in it open, and the patient smoothly lowers onto the couch. You need to wait until the air outlet from the pneumatic system is completely finished. That hissing sound. After finishing it, all the cables will be free. It will be possible to remove the cuff and release the patient.